But it is important to recognize that the genetics of ADHD are almost as strong as the genetics of height.
Correct.
So that it's just anybody who's working with ADHD, knows that you're sort of working with the whole family for that reason also, because a lot of the solutions for ADHD are harder to do when you have your own unmanaged ADHD.
Welcome to NICU Heroes, a podcast produced exclusively for NICU professionals, with me, Kathryn Whitaker, as your host. I'm the mom of 6 children, including my very own NICU baby. This podcast is produced by Hand to Hold, a national nonprofit dedicated to providing free personalized support, resources, and community before, during, and after a baby's NICU stay. As a NICU professional, you've been well trained to care for the tiniest and the sickest babies every day. While a NICU parent's scars are not as visible, those parents are often as fragile as their babies, requiring patience, guidance, and encouragement to ensure that they are mentally, emotionally, and physically prepared to endure the pressure of a NICU stay. NICU Heroes is dedicated to helping NICU professionals like you better understand, support, and nurture the entire NICU family. Howdy, everybody. Welcome back to another episode of NICU Heroes. It's been a really great year, yes? I have really enjoyed these deeper dives. This podcast allows us to go a little bit deeper into topics. Today's topic is going to be a little bit twofold. So ADHD, so attention deficit hyperactivity disorder, is often diagnosed in kids when they are older. And you may be saying, Kathryn, why does that matter in the NICU? Well, there's a couple of reasons. I want you to first understand what ADHD is, so how it presents itself. Not necessarily how it presents itself in children, but it may be that the parents or the caregivers of the person that's taking care of your NICU baby, your NICU patient, has ADHD. And so what you may perceive as either disinterested or maybe not kind of plugged into what it is that's going on with their baby, or maybe they're disassociative, or there may be so many other reasons as to why you're like, why is this not clicking? It could be because that parent or that caregiver has ADHD. So I felt like if you could understand it on the back end, how it presents itself in children, and then also how it presents itself in adults, that you may be able to better serve your patients at the bedside and the people that are loving and caring for them. I'm really excited to have my guest today. His name is Dr. Bertin. He's a developmental pediatrician and the author of How Children Thrive, Mindful Parenting for ADHD, Mindfulness and Self-Compassion for Teen ADHD, and the Family ADHD Solution, all of which integrate mindfulness into evidence-based pediatric care. And he's a contributing author for the book, Teaching Mindfulness Skills to Kids and Teens. Dr. Bertin is a faculty member at New York Medical College and Windward Teacher Training Institute, and he served on advisory boards for APSARD, Attitude Magazine, the Screen Time Action Network, Common Sense Media, and Reach Out and Read. He's the real deal. His blog is available through Psychology Today and many other places. You can also find him online at developmentaldoctor.com. So with that fantastic introduction and this really fascinating topic, let's get to it. Well, I'm excited to have Dr. Bertin here today. Dr. Bertin, thanks for being here.
I'm so appreciative of the invite. I'm looking forward to our discussion.
Well, you are really good at what you do. I've seen many of the things that you do. I've read some of the things that you've written and also listened to some of your podcasts. And I think it's always good for people to sort of get a little bit of the backstory. So why developmental pediatrics? And I know that developmental pediatrics is a pretty wide spectrum of things, but why did you choose to focus on specifically ADHD?
I get asked that a lot, and it kind of evolved over time. I grew up around the field of special education is really where it all started. So my mom's a pretty well-known teacher. She developed a curriculum for evidence-based reading instruction. So sort of grew up immersed in that. And then individually for me, when I was going through some difficult times in high school, working or volunteering at the local Special Olympics was very meaningful for me. Really became a big part of my life going back then. And I don't know, sometimes that sounds a little overly directed to me. It's not like I knew immediately I wanted to be a pediatrician, but I did know I wanted to work with kids. So I sort of thought about teaching, thought about child psychology, eventually decided I wanted to be a pediatrician. And then, and I don't know, it's always just been a part of the specialty that really grabbed me and really feels important to me. So I did general pediatrics a little while, sort of had the assumption I would kind of specialize with kids with developmental differences. And, that wasn't an exact fit. So then I did my training and here I am. So,
Well, I love that you mentioned that it was your mom that sort of opened the door a little bit. NICU moms tend to be just as protective of our kids. Like we want to expose our kids to lots of things. And I think
right.
that sometimes it exposes you. So while you may not have known back then, you sort of began to see maybe the world a little bit differently than most people did.
I think probably I did. And I have a lot of family and, who work and a lot of teachers in the family. I'm all special ed teachers. So, it's sort of been, dinner table conversation since I've been a kid. So,
Yeah, you normalized it early, right? Like it wasn't a
yeah,
foreign thing to you. Well,
yeah,
I want to give people an idea of what it is that you do on a daily basis, and then we'll sort
sure.
of dive into the ADHD component, but kind of give people
Yeah.
an idea of like what daily life looks like for you and how you work with your patients.
I assume you mean in my clinical practice.
Yes, yes, yes.
So developmental pediatrics isn't, there aren't enough of us, I don't think. It's a subspecialty of pediatrics, just like cardiology is for the heart or pulmonology is for the lungs, where there's two paths. You can get boarded in neurodevelopmental pediatrics, which is more of the neurology side of child development. And then what I'm boarded in is called behavior and development. So I work with kids. Really, I think most people, if you looked from the outside, would feel like the large part of what I do is actually a lot like a psychologist.
Yeah.
So I work with a lot of kids with behavioral challenges. I do evaluations, to help sort out if someone has, ADHD or autism or learning disabilities. Really, I mean, I screen for those. I'm not an educational psychologist, but it's a big part of my field. So a lot of the kids I'm working with have learning differences also. And, my day's kind of a mix of things. It's kind of in a way I really enjoy, where some of what I'm doing is helping parents coordinate services. Some of what I'm doing is kind of, hands-on interventions myself in terms of, behavioral management or sometimes prescribing medications or, I have it's sort of an option for people. It's obviously not mandatory for everyone, but I bring mindfulness into clinical practice when people are interested and engaged in that. So day to day, that's really what I'm doing. I'm sort of just helping families, trying to support families work through all that. I think that's an important detail we should touch on today, because I think
Yeah.
it's, overlooked quite often how, really the whole family needs support usually around when kids are
Yes.
having difficulties. And I really try to emphasize that.
Yeah, I know that most of the people listening to this podcast are people who work in the NICU, but I think that we would all agree that the
Yeah.
more people that you can get on board, it's not just this one person's thing to work through or deal with. It affects the whole family. And certainly
Yeah.
when it comes to ADHD and many of the behavioral things that kids deal with, it impacts a significantly bigger circle than just the child
Yeah.
themselves.
Yeah.
So,
Absolutely.
so let's talk about that. So like what might present in a child or in a person that they might say, hey, maybe I need to go see a doctor for this. Like some of the things
Right.
that I'm experiencing maybe are not adding up. Maybe this particular thing
Right.
we can attribute to, not getting enough sleep, but then I add all the other things in and it doesn't work.
Right.
So give people an idea of what might those be.
Sure. I think there's several different, probably two or three different pieces to answering that question. And I assume you're referring back to ADHD. So,
Yes.
For ADHD, I think we really, as a, field, need to totally reframe how we talk about it, because, there's so much misinformation out there, and the misinformation itself causes people to have, way more stress and difficulty dealing with something that's already stressful and difficult.
Right.
So the first thing to understand when it comes to deciding if someone may or may not have ADHD, or if you should be concerned, is that it's not really an attention disorder the way we understand it anymore. Attention is a piece of a big umbrella of a skill set called executive function, which are kind of like our life management skills. And that means it includes attention and behavior, but also, as you get older, organization, planning, time management, emotional self-regulation, they're all influenced by executive function. You need those skills to accomplish those goals or tasks in life. The other thing that's important to understand is that it is a developmental path, meaning that the skill level we would expect of somebody around executive function is really different over time. And in fact, that part of our brain matures until we're 25 or so that you can almost, that you can get more granular, but for today, probably don't need to. But you can just imagine that when you talk about life management skills, a 5-year-old, a 15-year-old, and a 25-year-old are really different.
Right.
But that is the most important thing to understand, both because it explains the evaluation and when to be concerned when somebody's behind. So, because they are, even though they often don't seem like it, we don't look at things like focus and motivation and emotion necessarily as a skill set, but they're all supported by a very concrete skill set. So if you just can't focus, it's not a matter of effort alone. It's a matter of, oh, what can we do to help you focus? Or if you can't manage your emotions, it's important to see it through that lens. It doesn't mean you're forgiven everything. You can still get in trouble, but we can recognize that that's part of poor executive function. And, we need to sort of reach out and figure out how to bridge that gap in skills. So the evaluation of ADHD, therefore, you can frame it slightly differently in kids and adults, although practically speaking, it's the same. It's basically a two-step process. You're more or less saying, as best as we're able to gauge, because there's no perfect test of executive function, are your skills, in the ballpark of what's typical for age, or are they looking like they're behind in terms of, in younger kids, it might just be around focus, hyperactivity, impulsiveness, and emotion. And then the real, key point, the difference between like, oh, I'm kind of tired, or, oh, my phone's too distracting, is that to have ADHD, you have to reach the point where it's causing you chronic impairment in some way.
Right.
And that's just the bottom line. It almost, like, as a starting point, forget the label. I mean, the real point is if you're in the range of typical development, you shouldn't be causing yourself a chronic problem. That's really what it comes down to on some level. And people don't love the word problem, but, so use whatever you want to use, impairment or difficulty. But it's like, you should be chronically struggling in some part of life. And forgetting the label, even if you are, clearly it would be useful to support you. When it comes to kids, if you're a parent or teacher working with ADHD, the more aware we are of the specifics of what's going on helps guide all the possible interventions, which is why you don't want to avoid evaluation. You want to know what's going on. And if what's going on is someone is, far enough behind in executive function that they need some supports, we want to know that as early as possible. And it really is a parallel to adults ADHD. I mean, you wouldn't call it a developmental condition at that point because, it's not that you are still developing, it's that you haven't outgrown those difficulties with executive function. But really the evaluation is the same, and it's kind of subtler than most people think, because executive function is our life management skill set, which means it can affect almost anything. Research in ADHD, is now showing that it actually has long-term impact on health and well-being because, not because it directly affects your health, but because that's the skill set you use to drive safely. And, people with untreated ADHD are at risk for substance abuse. And, it's harder to maintain a health routine and sleep well. And it has this sort of domino effect so that you can it also, I should say, it's a skill set we use for the difficult stuff in life. So it affects things that are harder more. So you can get, like, a student can easily get blamed for, like, why can you focus on math but not on English? And it's like, well, if math is totally effortless, it's not putting the same demand on executive function. You're going to have an easier time focusing. So it's not like uniform. But that does mean, like, even as an adult, you can be successful from the outside and everything's taking you like 20 times the effort it should. It's like you got, you are just motivated and working hard. And so on the surface, everything looks like, you're a successful business person, but inside you're just exhausted by constant disorganization, running late, forgetfulness, and you make up for it. But it's just like, it's a short path to burnout and certainly not well-being. So that's kind of the big umbrella of what you're looking for with ADHD, is like a chronic impairment of executive function at any age, that's causing an ongoing difficulty.
That is it's fascinating, really, because when you think about, like, at any given time, someone can be distracted or someone can be impulsive. But I think I loved your caveat to say when it begins to impair and it's chronic and it begins to impair, then that's when we have to take a harder look. I actually want to dive a little bit more into this executive functioning piece because I think people hear ADHD and they think, oh, they're just distracted, or, oh, they just don't pay attention. And if only they would have a planner, if only they would try harder, then they would be able to do this. So I actually want to dive a little bit deeper into executive
Great.
function. So
Okay.
let's talk about like what exactly is executive functioning and how might someone who's been diagnosed with ADHD, what are their biggest challenges?
Well, it's very individual, but I will give you
Right.
one framework I often do and then get into the details of executive function because it applies to everything ADHD. Sometime when I'm working with schools, I lead with this like that's not like a joke, but like one line, which is forgetfulness is an ADHD symptom. So what are the implications of that? But remembering and keeping track of things is part of executive function. What it means is that if you have a student who is chronically like not handing in their homework, and all you do is mark them down over and over again with the assumption that if they cared enough, they'd remember, really all you tend to do is like destroy their motivation and spirit over time because it's
Right.
a skill they don't have.
Yes.
The only successful way forward, if you look at us like forgetfulness as one aspect of executive function, is more skills based. It's like, well, we can hold you responsible for the new plan we create that will teach you to be less forgetful. So it's not that you have no responsibility. It's just that you have to meet it like a skill set. Like skills develop sequentially. If that's where your skills are, there's no value to just like letting you bang up against your forgetfulness all the time. We have to bridge that somehow. We have to say, oh, look, this is part of ADHD. So we're going to build this system in place that over a year or two, maybe we'll teach you to do this, and then the goal is independence. But right now you're not there yet, which by the way, when we get there is obviously a huge part of why this is so exhausting for parents and teachers is that's just, the kids are behind in those fundamental skills that let them be more independent. But when it comes to executive function, I usually do say, it's a perfect question for you to ask, but I usually do say, like, if you're going to live with ADHD, you want to feel like executive function is just like a real word, not like some buzzy science word that's confusing. It's like, this is where the rubber hits the road with ADHD. So everybody's individual, which is why one thing I haven't said yet that I always make sure to say talking about ADHD is we don't really use the term ADD anymore because it's more the inattentive type of ADHD, or now it's called ADHD with predominantly inattentive symptoms. I think they just mix up the books once in a while just to confuse people as much as possible. But the reason they did it actually does make sense, which is everyone's ADHD evolves over time and it's situational and, it depends on, the teacher or your boss and, and you're having good days and bad days. So it's not so, entrenched. So it's like ADHD is this basket of struggles with executive function. I think the most practical model to understand, which is to answer your question, is Thomas Brown's model of executive function. A lot of brilliant models out there, not to take away from anyone else's, but just in terms of like use, I find it really useful. So to go over it very, quickly, and then you can guide me on where you want to go from there. There's 6 parts to it. The first one is an important reframe. It's called attention management. Because what happens when people struggle with attention is actually several things. It's almost like a hyper focus on what's easy and fun. They can't focus on what's difficult because it's like an effort thing. They can't raise the bar that high. They got, kids, for example, often get blamed for that, like I just mentioned. Then a big one is they can't transition attention, which kids often get blamed for too, because it seems like you're ignoring an adult. So if you're hyper focused, like on, watching a show or even reading or art, or you're just, your attention is just totally absorbed. And someone says, we got to go in 10 minutes. If you can't shift attention, you don't even hear the question, and then that could lead to a big escalation when it's really just a neurologic symptom. Like, unfortunately, again, all these things add up to more work for parents. You can't make a request of someone who has difficulty of attention shifting without getting their full attention first. And, they could choose to be difficult then maybe, and that's a different discussion. But quite often that comes across as difficult when really they just can't shift attention. So that's part one. The second part is the behavioral part, which is, again, the cliche of ADHD, almost the minimal view of ADHD, but it's part of it, which is, dysregulation in terms of being hyperactive or overly impulsive. Again, it's a very useful reframe to realize, sometimes it's like you still get in trouble, but if you take the judgment out of it, it helps a lot. Like, if you impulsively do something wrong, part of learning might be getting in trouble, but recognizing as an adult that impulsiveness is a symptom. It doesn't mean kids don't know better. One of the best one-line summaries of ADHD ever is Russell Barkley's model, who said, it's not a disorder of not knowing what to do. It's a disorder of not doing what you know. Impulsiveness doesn't mean you don't know better. Impulsiveness means you're impulsive. So you might get in trouble, but that's learning, but you don't have to add anything to that, because it's not like they didn't know better. It's just they haven't learned how to control their impulses yet. But then the rest of executive function is what people often aren't aware of. And that's where you really begin to see how it can affect communication skills and relationships and hobbies and almost anything. Because as you get older, a third part of it is often called task management, which is organizing, planning, time. Some people think time blindness eventually becomes the core problem with ADHD. Information management, which is something called working memory, which is keeping track of stuff in your head kind of before you store it. So if you're listening to this talk right now, that's all working memory, and you have to keep track of what you think is important and organize your thoughts in case you have a question or you want to take a note or whatever it is. That's all working memory. Again, if you have someone has challenges with working memory and you send them upstairs to do 4 things, but they can only keep track of 2, they're going to look like they're being difficult because they're playing with their Legos, but it's really just a working memory issue. So that's another aspect of it. Effort management, which is, again, just these are the nuances of how people often understand kind of like hard work. I mean, effort management is kind of like the neurological correlate to physical fitness. I mean, you can be motivated to complete a task, but if you can't sustain effort because of ADHD and you drift off, that doesn't mean you don't care. That means you're struggling with sustained effort.
Right.
And then a huge one, which I think is just barely beginning to be talked about enough, is emotional management, which is that, we all experience emotions all the time. And if we're not aware of them and managing them, they have a big impact on how we think and act. And being overly reactive is kind of a, routinely challenging part of ADHD. Some studies say half of kids with ADHD have it. So it could be quick to frustrate, quick to cry, quick to throw tantrums and get angry. And that's the big umbrella of executive function, so that individually, it's this and that. It's not any one thing. It's like everybody has their own strengths and everyone has their different, it's like anybody's ADHD can impact any of that, differently, but that's what you're looking for. And I think you mentioned something about, a day planner. That's one of the examples I use all the time of like, just like forgetfulness, like where someone says like, well, why don't you just write your homework down in your day planner, with the implication of like, if you cared enough, you would.
Exactly.
When that takes like, 5, 6 aspects of executive function to do, you have to be listening to the teacher at the right time and know where your day planner is and know what page you're supposed to be on and know where your pencil is and not impulsively running into the, playground with your classmates. Or maybe you're being totally motivated on the ball, but you think like, okay, I'm going to write that down when I get to my locker, but you're struggling with working memory. So you forget it by the time you get to your locker. And, that simple task of like, why don't you write it in your day planner is actually really complicated from an executive function point of view. And the thing is if you can see ADHD that way, to me, that's how you can problem solve. Like I have a worksheet I use sometimes of like, okay, let's look at this problem and just brainstorm like what of these 6 parts of executive function, where might this challenge be coming from? Like what might the root cause of it be? Because it's going to be different for everybody. And there's a little bit of trial and error to figuring it out. Sometimes it's not so, testable and concrete as much as just like working with someone until you figure it out.
Oh my gosh, I have a million questions for you. Okay, so let me start here. So first of all, that sounds like a lot for someone to manage, particularly if they don't know that they have ADHD, or even if they do. You have to figure out where are my biggest deficiencies and how do I tackle that and where do I go get help?
Right.
And that's a bigger conversation. But I want to switch for a moment to maybe the adult that has ADHD. So let's say that now they've been put into a high stress situation. They have a child in the neonatal intensive care unit. They have ADHD and their relationship with the nurse or the NICU professional is difficult. What might be some of those things that maybe they're struggling with, Dr. Bertin, and how can, on a NICU professional side, can someone say like, hey, this isn't them not caring about their baby, or this isn't them not keeping track of X, Y, and Z diagnosis. How can we better serve both the baby that we're serving, but also the parent that's giving them good care?
That is another great question. And there's a nuance there, because when you're talking about the NICU, there's a little bit of a piece of what I'm about to say like doesn't apply all that much quite yet, but it is important, because there's other reason, the kids aren't the ones struggling with attention at that point, but it is important to recognize that the genetics of ADHD are almost as strong as the genetics of height.
Correct.
So that it's just anybody who's working with ADHD, knows that you're sort of working with the whole family for that reason also, because a lot of the solutions for ADHD are harder to do when you have your own unmanaged ADHD. So, so it's usually or sibling, everyone in the family has a several-fold risk of having ADHD if one person has it. So what that means when you're, trying to support someone with ADHD in the hospital, there's several different parts. I think, again, the simplest answer to your question is to go back to that 6-part model. Mm-hmm. And I don't say this, I'm saying this in a nuanced way because words can be twisted. It's almost like you want to depersonalize it. Not that ADHD isn't highly personal, it affects people. So I don't mean it in that way, but I mean it in the sense of like there's skills that are, a challenge. So that if you're trying to work with an adult with ADHD, it's really going through that same 6-part checklist and realizing that, if they seem distracted, it may be, that you need to go have a conversation in a less distracting place than the NICU itself, because there's too much going on in the environment and that's distracting. And if they're making impulsive decisions, that's not so helpful sometimes, but at least you can recognize, like, if this is ADHD, it's not that they didn't know better necessarily, certainly the organization and planning part of ADHD, you can extrapolate. So for the organization and planning, like keeping track of stuff, forgetting things like you're talking about, there's some like fundamental guidelines working with ADHD. And one of the most fundamental is if it's hard to keep track of stuff in your head, which it often is with ADHD, you're trying to teach people like just kind of, and again, it's an overly simple statement. It's like simple to say, hard to do, but the concept is then let's work on a system where you just don't keep track of stuff in your head. You're going to alleviate that challenge if you just, the challenge is that a lot of the things that intuitively come to you if you are an organized person or have strong executive function, like using a to-do list or managing time, it's like you just do the things that it all just sort of snowballs in a positive direction. If you're just not sort of, if you're having a hard time with executive function, those aren't your habits, you're almost even quicker to dismiss. Like I've tried to-do lists and they never work, but that doesn't mean that something along those lines isn't part of the answer. It usually is part of the answer. So part of it may be, which by the way, a lot of these things are like more valuable with ADHD or more required with ADHD, but really they benefit everybody else. Right. Which is, it might need to be very concrete and write it down and make checklists and charts and like just keep it all very clean and literal so that, there's less room for misunderstanding or missing but in terms of just like helping parents remember, like, this is the time to do this or that, it's all for that one part of ADHD. It's all about structure, really. It's the concept again from Russell Barkley is externalizing the system of just, keep it as unambiguous as possible, alarms and, calendars and to-dos and visual charts, and just don't keep track of anything in your head is kind of part of the solution for that part of things. And then I can imagine a big one, and, when your kids are struggling, emotions are powerful. And again, one of the most, at some point I'm going to have to use a different story because I just found this so powerful. And I anyone who's listened to me more than once has probably heard this story before, is like, just taking the judgment out of things matters so much. And so I had this experience a couple of years ago now with a family who came in, and after like all I had done was just explain the basics of what I thought was going on, they came back like within a week and said things were better at home. And they were clearly joking. I knew I could joke around with them. And I said, well, how could things be better at home? We haven't done anything at all yet. And his mom said, oh, he's still reactive all the time, but, I don't judge him for it anymore. I get it. Now what are we going to do about it? Like, it wasn't that the problem had gone away, but that changing the relationship to the problem mattered so much. So, the same thing goes. A lot of times in my experience, or when you read, hear people speak who have ADHD or read, what they've written, the emotional reactivity that goes along with ADHD, is simply it's like the emotion takes over, but they're having a hard time managing emotions, but it doesn't even necessarily have the depth it seems like in that moment. Like, so for somebody with ADHD, or for a kid with ADHD, it often just like, it's out there and then it passes. And, it wasn't bigger than that. It was just like, it was a huge emotional outburst, but there wasn't necessarily a whole lot more to it than that. We all experience big emotions regularly on and off throughout our lives. And part of living life day to day is being able to notice them and not get caught up in them and not react to all of them. And if you're struggling with that in a charged situation like the NICU, a situation where there's already going to be a lot of emotion going around, you can have some big explosive emotions that maybe, aren't as, personal again as they seem.
Right.
It's just, it's not necessarily, given the opportunity a lot of the time. Sometimes in communication, it's called communication repair. There's a lot of opportunity to let the emotion pass and not, and discuss it after, once it's settled, because a lot of the time it's really just an expression of reactivity and not more than that.
I'm really grateful that you said that. I mean, I think this has been a theme that's come up with many of the guests, is this desire to be curious about people instead of just maybe seeing the reaction or what they do for face value, and instead knowing there must be something deeper there. There must be something
Yeah.
more there. And so I love the reminder that the emotion is just the symptom, but it's not the actual root cause of what's actually happening. And so when you can remove that judgment, I mean, not only does I think it certainly helps you see them in a different way, but I think it helps you move through whatever difficult thing that it is that you're moving through. Not necessarily detached, but aware
Mhm.
that they are not always the same thing.
Right. And there's another nuance to it, I think, too, which is also a little bit of trying to understand emotion separate from behavior at any age, of
Correct.
recognizing, that part of communicating with anybody or connecting with anybody is trying to understand their emotional experience of what's going on. I mean,
Right.
to be empathetic or compassionate is just fundamental to, connecting with people and understanding them. So realizing that, that the outburst is different than the emotion, and we want to understand both parts of it separately. Not, you can't literally separate them, but recognize that they're two different things. You're
Right.
having an emotional experience. It's worth trying to, like you say, be curious and try to connect with that and understand and reflect that back. And that if you're having a lot of emotional reactivity, that isn't necessarily, that's a different thing almost.
Right. So when it comes to, if you know someone, which by the way, thank you for mentioning that adults who have ADHD, sometimes there's this correlation that their children or other people in their family may also have ADHD. Because while I know that a 32-week baby is not going to be diagnosed with ADHD,
Correct. Yeah.
certainly babies who are in the NICU who receive way more input with machines and noises and all the other things that are in a NICU certainly open the door to some of those diagnoses later on. So thank you for mentioning that. I'm curious, Dr. Bertin, when it comes to the actual, I guess, treatment or ways in which we help people develop
Right.
better executive
Right.
functioning, how to operate better in the world. I know that there is a wide array of
There
opinions
certainly are. Yeah.
and things that you can do to address and also help people live and really thrive with ADHD.
Hmm.
Maybe let's touch on what some of those might be that you think are most effective and that maybe that you use in your practice. I know it varies from patient to patient, but kind of give people an idea of what the choices are. This podcast is produced by Hand to Hold, a national nonprofit, but we're more than simply a podcast. Hand to Hold is here to support your NICU in two ways. One, you can refer your NICU parents to us for support, or two, you can bring dedicated Hand to Hold support to your NICU, either in person or virtually. Our support consists of one-to-one group and educational resources, including our family-focused podcast, NICU Babies Parent Support. For more information, visit handtohold.org and click on NICU Professionals.
I think I'll give you an umbrella overview of what's possible, because it is, I mean, again, the art of it is to individualize it. But, I typically organize my thinking around ADHD interventions into four aspects of life, which I think if you sort of see them widely covered just about anything you can talk about. So, so part one in childhood, at least, are school-based supports. And the 2 bullet points to know about that are, first of all, in the best of circumstances, schools, and I don't say this is always true, but broadly speaking, they're accommodating for ADHD. They're not the intervention for ADHD,
Right.
but they are required by law, which is the second point, to, that anybody's entitled to an education. So they should have a educational plan in place, which can be a 504 plan or an IEP that fully supports someone who may be, completely academically gifted even and can't manage things, because there are some people estimated as like a 1/3 delay in executive function. One part of the plan to examine over time is the school plan. There are some correlates to the workplace, but it's a whole other discussion. It's a much harder thing to do. The second thing to look at are the most proven non-medical interventions for ADHD are various types of behavioral supports you do and families do, basically. So from a research point of view, the most proven non-medical intervention for ADHD is probably just old school cognitive behavioral therapy, just like rolling up your sleeves and working on executive function skills, just like you'd work on a speech language delay or a motor delay.
Mm-hmm.
And it always helps in my experience, and the research says it's helpful. It doesn't always help fully on its own, and we'll get to that in a second. But that's one part. The younger kids are in particular, but really almost at any age, parent training has a lot of value. Not because it's anyone's parenting right or wrong, but just because parents have the grown-up brain. So if you give them tools to implement of, how do you support emotion at home, or how do you support organization at home, or any of these things, parent training can have a lot of value. More and more, there's a field called ADHD coaching, which has a lot of value that's being used. Coaching focuses mostly on the organization and planning and sometimes the emotional part of things, but isn't therapy. And it's really, really helpful in many families, but it's very collaborative. So coaching is usually used in, sort of teens and adults once they're ready to collaborate on a solution. The third basket to sort of be, and by the way, if this sounds overwhelming, it's really just meant as this, you might just check the box and say, nope, got that covered, but it's just a way of looking at what's possible.
Right.
The third really important part of intervening for ADHD is the health and wellness part. It's been shown in multiple ways to affect health in ways that actually, forgetting long-term health, also affect your ADHD itself. It's like a vicious cycle, so that ADHD leads to sleep problems or eating issues or sedentary lifestyles, all of which then make your ADHD work and can kind of snowball. So that's an important, again, individually, that can be a big deal in some families or not a problem at all. I would also include the practice of mindfulness in there, which has been shown to, it's very helpful for executive function and attention and emotional regulation. It's not a replacement for anything else, but it can be a support in terms of health and wellness. It's very powerful. It's really supportive in terms of that big picture. The reason I started teaching mindfulness in Western medicine, which was a leap at the time, is because it helps so much with just like self-regulation and resilience and stress management. And if you're living with ADHD, you gotta, those are big challenges.
Right.
So that if you practice mindfulness, it sort of helps you do all the rest of ADHD care more easily, if nothing else. So, but that's also harder to do if you have ADHD. But that's, one other area. So that is sort of the health and wellness piece to look at. And then the last one is such a huge one. And, I always want to mention it because there's so much misinformation. It's unfair. I mean, now it's become a political issue, which honestly I think is kind of pathetic because like the science is really proven, is that, so to take it step by step, I mean, we know ADHD, if it's correctly diagnosed, whole other discussion, certainly can be misdiagnosed, but if it's correctly diagnosed, we know beyond a shadow of a doubt that it's a medical disorder. We can't test for it yet, but between the genetic studies and group brain imaging studies and all, it's a medical disorder if it's correctly diagnosed. There are a lot of medical disorders you can try to manage non-medically. So that doesn't mean you must use medicine, but it is the rationale for using medicine. And in spite of how they're talked about, they've been around for about 100 years. They were first used in the 1920s. After 100 years of use, there are not any long-term side effects that we're aware of. All the side effects are on the surface. So if they're managed well, if there's a side effect, you just stop them. Literally, that's it. You just stop it, move on. There's a brutal trial and error to getting them right sometimes, but the end point is good. Again, from a research point of view, 80 to 90% of people can get at least some benefit from the medication without significant side effects. Doesn't stunt growth, shouldn't change your personality. It really should just be like I know it's not literally true, but it should feel like wearing your glasses. And the science says that it really is far more likely to impact the kind of core ADHD symptoms than anything else. So when you think of like focus, hyperactivity, impulsiveness, those often respond very robustly to the medication. People are often terrified of these medications. The research seems to suggest that, they head off multiple problems. There's a couple of studies suggesting that if you use them early, you're less likely to need to use them when you're older. They decrease your risk of substance abuse in ADHD. They don't increase your risk of substance abuse. So my goal in ever even giving that much about medications is I just think it's unfair to people how they're framed.
Right.
And it's gotten much worse recently, on a national level, because in the end, they shouldn't be thought about any differently than any other medication. Don't use a medication you don't need in life is a fundamental, piece of sound advice. Don't be particularly afraid of these medications as long as they're being used appropriately. They're really safe and effective if they're used right. And the research says that if you have ADHD, most people benefit from them.
I thank you for that very comprehensive overview. I think perhaps it's just a matter of people have misinformation in the sense that they think, oh, ADHD, that just means you're distracted, get yourself just get organized and you'll be fine. And I don't know why you have to medicate. I think there's a lot of misinformation, a lot of myths as to what ADHD is. And I think that executive functioning piece is the part that I think a lot of people are missing. And then, like many things, when we deal with kids who have all sorts of medical challenges, you wouldn't tell someone who had diabetes, you shouldn't take insulin. These are things that we offer because it helps, like you said, kids. So, Dr. Bertin, as we're thinking about how you sort of figure out this is the right course of action for me if I'm an adult or even if I'm a child who has ADHD, where does one start to say, okay, I have ADHD, now what? I know it's individualized, but sort of what's the process that you go through to figure out what's the best thing and the best course of action for that person?
I do think that, like most behavioral interventions, it's not a yes, no answer. It requires just a little bit of long-term thinking, not that long, but it's the way I often frame it when I'm talking to families is if you believe someone has ADHD, then some sort of chronic challenge is part of the situation. So you want to be doing something. You can't definitively know what to do, but most of the time it's not a crisis. In fact, if it's a crisis, you might not be talking about ADHD or ADHD alone anyway. I mean, this is so most of the time it's not a crisis. So what you have to do is really just decide what steps make, sense next. And then there's a lot to that. So there's because it's all trial and error. So, if you want to decide that, all right, I'm not really, I don't think putting aside the research, it's not, medications aren't for me right now. The most important thing is I think because these things seem so sort of open-ended, people often sort of watch and wait and don't respect the fact or don't give themselves permission to actually do actual interventions. It's I'll get myself a different day planner or whatever. If you have a diagnosis, you want to be doing something, definitive to try to support yourself or support your child. And if you want to take a more behavioral path first or an educational, the thing about doing an educational intervention alone is usually, again, that's an accommodation, not an intervention. You're sort of helping someone who's behind, but you're not necessarily doing much to catch them up.
Right.
So the real answer to try to be concise about it is, knowing that, those options, it's sort of individually looking at, well, what's most impacting my life right now? Do I need to you want to do a sleep intervention first? Do I want to work with a psychologist first? Do I want to work with a coach first? And then you just want to be very assertively checking in, is this working enough? So the answer to your question is just putting the planning just a little farther out in the future, because if it's, it's not a crisis, you don't know. So it's like, okay, I'll give it 3 months of working with a coach, and then maybe with the coach, we'll reassess whether I'm going to try medication, or I'm going to, I don't have time for a coach, even though I know, again, if you do a little research, you'll find out that the medications don't necessarily help that much with organization, planning, and time management. But you might just say like, all right, I'm going to try the medications first. And then that requires a ton of trial and error to find the one you're comfortable on, which is really, if you're individually living with ADHD, that's an important thing to know, is like most of the medications are kind of what you see is what you get. So you don't have to watch very long if you don't like them. So part of getting through that trial and error quickly is just realizing, you don't want to be sitting and making changes quarterly. You want to be making changes as quickly as makes sense until you're on something you're happy with. Now, that doesn't mean every day either, but, finding some middle ground of relatively quickly until you're happy. But then maybe while you're doing that, you're also in the back of your mind knowing that, okay, that might not be enough, because that, I have time blindness probably, and I need help with that too. So I just think as much, it's hard to make a blanket statement. I think the most important thing is to be proactive and compassionate with realizing that, so many of the things in this field, around executive function specifically, are like simple to say, hard to do. So it's easy to get caught up in self-blame and self-criticism. And everyone tells me I should have a to-do list, but I've tried it 15 different ways and it never sticks. And, it's a lot about just recognizing, well, that's because you have ADHD. It's like a vicious cycle. Right. Executive function are the skills you use to plan and manage stuff, so that it's a little harder to start planning and managing stuff. It doesn't mean you're never going to get there, but it does mean working with someone else. Like if you want to learn piano, most of us would have to go find a piano teacher. You got to go work with someone on it and you'll get there. But it's going to take a lot of like little of this, little of that. That worked, but not fully. Now we'll try this. And really, that's what it takes to get on top of it over time. With kids, sometimes I even recommend, and I think adults could do this too, almost making a triage list, because it's like, if you try to address everything at once, you're just going to fry, you're going to get fried. And like, habit change doesn't happen that way. You quit on the whole system if you're trying to change 10 things at once.
And it feels overwhelming.
And it's just totally overwhelming, and you feel like you're getting nowhere. So if you literally sometimes make a list of just like, here are the 10 things I'd like to accomplish this school year, and then just pick 1 or 2 to work on initially and almost back burner the rest, that everyone feels more successful. You're more likely to be able to stick to that plan. And, and then you put a line through it and move on to the next one. It's not like you're giving up. It's just a matter of prioritization. And I would, hazard the same thing probably goes for adults, is recognizing like, if I'm having massive struggles at work because I'm not handing my stuff in on time, and I'd like to work on, I don't know what, to pick something trivial, like, being more consistent with, washing my laundry, you might just say like, okay, I'm going to work on the time management stuff at work for now, and whatever, the laundry, I'll get there someday, and that sense of prioritizing can help a lot too.
Yeah. I mean, and as I'm thinking about maybe a parent who has ADHD and they're in the NICU, I mean, I think it's overwhelming. I'm type A, and it was overwhelming for me. So I can only imagine if I had challenges with executive functioning. So I think it becomes a matter. I love the suggestion of not just write it down, but like, what's the most critical thing that needs to happen, right now? And so if you're the NICU professional, like if it's follow-up visits, then, we're writing down the follow-up visits, and these are the specialists that you need to go see. And then when you go see these specialists, these are the questions that you should ask.
If you can create a system of redundancy, that, that helps a ton, because that's just part of mismanaging time and difficulty with forgetfulness, is like, and if an appointment's missed, no blame, just some red flag needs to get put up so that somebody follows up and says, oh, you missed the GI appointment, and maybe makes an extra follow-up call, or there's somebody who's aware that needs to happen, who's checking in on it,
Right. I want to actually go back to the mindfulness piece, because I know that's a big part of your practice. Yes. Okay. Maybe define, what is mindfulness? What do you mean by that?
Sure.
and then what that looks like when it comes to treating ADHD.
Absolutely, because you can't practice it if you don't understand what it really is. I'll say what it's not first, and then I'll jump in. So it's not getting rid of all your thoughts, and it's not being calm or sitting still all the time. Just put that totally aside. So there's 2 ways, I think, 2 starting points to thinking about it. I mean, it does have an actual definition, but that doesn't really capture what we're doing. But the definition is aiming to live life with more moment-to-moment awareness, with compassion and responsiveness instead of reactivity and autopilot. A lot of words. One of the things I always say talking about mindfulness is ask yourself, it's an old saying, it's not me, ask yourself if what you're hearing, is it true? Like, it's not going to change anything if you don't believe it's true. So to put that into real life, why it matters is you can just recognize that if we don't put some work into it, we tend to be caught up in kind of this lack of awareness, like reactivity. We're not really paying attention to what's right in front of us an awful lot of the time. And we never get perfect at that, but it does have implications. And it could be something like, there's been a little research that, that our thoughts tend to spin into like frightening stories of the past and frightening stories of the future and negative stories about the past. And if we're not aware of that habit, we burn ourselves out pretty quickly. Or it could be, that we're having a conversation, but we're not giving the person we're talking to our attention at all. And that has implications in how we speak. Or it could be our emotions are driving the bus and we're not really paying attention to our emotions. So we're making a lot of emotional, decisions, and we're talking to people a certain way, but we're not really aware of what's going on. So the simplest way I think to look at mindfulness as a starting point, because it has many, many more layers, is it's really just trying kind of like a gym program, like mental training almost, to build traits that we think will make life easier to manage, like, being more aware, not fully aware because no one ever is, but just more aware. Like, oh, this is a moment where, if I was thinking about yesterday's Nick game, it would not be so valuable while I'm having a conversation with you or whatever it is. If I'm trying to manage homework today, but really I'm worried about college 10 years from now, that's not going to help us handle homework so skillfully. Awareness also ties directly to some of the behavioral interventions we're all asked to do. There's something called the negativity bias in life, which is, presumably for safety reasons, the big scary stuff grabs our attention more, or just the frustrating stuff, anything that seems off. With the basics of relationship in a family and any behavioral intervention are pay attention to the positive moments and, give our kids praise when they do the right thing. And, you can think of the average morning trying to run out the door and, it's really easy to take for granted the 3 or 4 things that went well because, right at the last minute, your child hasn't packed their backpack yet. And then the first thing they hear from you is like, what the hell are you doing with your backpack? Right. So it's almost like a mindfulness activity. Remember, there's a lot more going on there. Even a misbehaving child probably isn't misbehaving every minute of the day. So it's not that their behavior is okay, but it's a filter to see this is what mindfulness can mean, is like noticing the other stuff too. So the practice of mindfulness is an ongoing practice of aiming to, instead of just living in that kind of reactive autopilot, just choosing to develop traits like patience or awareness. There's no one thing. Mindfulness is like trying to describe like physical exercise. There's lots of different types of practices that are under that umbrella. But we're aiming to develop these traits that, that are going to spill over into everyday life. So when it comes to ADHD, I think just a foundational starting point is that because it affects executive function, which affects independence and emotional reactivity and all these things, ADHD itself is a very stressful and overwhelming condition to be living with for many or most people, initially at least, until you're on top of it. When we're feeling stressed and overwhelmed, that makes decision-making harder, changes how we talk to people, makes it harder to stick to behavioral plans, makes it hard to make rational decisions. So just as it's really like an analogy for all of life. Like whenever we can get our feet under ourselves and just feel a little more patient and responsive with whatever's going on, even if it's challenging, of course we're going to handle it better. We all know that. There's a big aspect of mindfulness practice. It has to do with an idea called self-compassion, which is recognizing that, perfection's impossible and I'm going to make mistakes, and really trying to learn to treat ourselves like we would treat somebody else who was struggling, which is not how most of us, intuitively think about our inner world. And it's all just part of this practice. And I think, sometime during COVID, I actually really started putting a lot of attention into teaching, when teaching meditation, that, it really, on some fundamental level, not because there isn't much more to it, but as a starting point, is really a practice of patience. It's really like, how often in life do you spend 10, 15 minutes and just give yourself permission to just sit with whatever's happening and not do your normal reactive habitual stuff? This is hunger. and I can give myself 10 minutes to experience hunger without whatever I typically do with hunger, or I'm angry, or I'm anxious, or whatever you're experiencing. And if you practice it regularly, it's not so much about the meditation. I mean, often it feels relaxing, which is nice, but that's not even the point. It's like if you're training for the marathon, you should just run every day. And if you have a bad run, you were still training. It's still a valuable thing to have done. So when it comes to meditation, the reason truly anybody can do it if they want to is you're just trying to build patience with whatever's going on. If you have a really busy, distracted mind, what's it like to, recognize that without whatever typically comes next? Whatever it is, if you're emotionally reactive, this is one of the most valuable aspects of mindfulness, honestly, is that you can build and build that ability to recognize whatever emotion's happening without the immediate reaction that normally follows. So that's mindfulness in a nutshell. And there's countless things you can do with it. This is not about the practice itself. It's about, building the traits that help us relate to the challenges of life.
That just made me a lot less stressed, actually, as you were
Oh,
talking
good.
through, like thinking about, and not just ADHD, but many things, this ability to sort of recenter and refocus where you are presently, and then sitting with that and getting uncomfortable a little bit, and then sort of working through it, but not feeling like you have to solve it at the end of 5 minutes. I appreciate that a lot. I have two last questions for you. One is
Sure.
really focusing on just this implicit bias, I think, Dr. Bertin, that some people may or may not have access to the things that they need to successfully navigate a diagnosis of ADHD. Like, what are some things I think that you do in your practice, or ways in which overall as a developmental pediatric community that you can do a better job of maybe serving those people who sort of fall into the gap of not getting the services that they need?
Wow, there are a lot of layers that in a health system like ours, there are an infinite number
It's
of layers
hard.
to that. I think the fundamental one is actually, to put it through the lens of mindfulness. Another phrase usually used in terms of mindfulness is, it's sometimes called non-judgmental awareness. Just seeing things as they are, not because they're perfect, but because this is how they are. And recognizing there's value in that. And I think that's a huge part of ADHD, is just the educational part of it. It's just like, so if nothing else, and I wish everybody could get everything possible for ADHD, but if nothing else, start from the premise of, like, if you really see with clarity, and without judgment, this is what's going on, that helps a ton just as a starting point. In terms of the actual interventions, I think, it's a countrywide problem. I mean, I was actually once involved with a whole journal issue for, I think it was the International Dyslexia Association, just about trying to help families understand what services are out there and how to implement them and make them happen. So, I think a lot of families, by necessity, need to lean into their schools. And even though I said schools only do accommodations, that's, any individual school can often do more than that. So you can try to work with schools a little more closely. I think when it comes to non-judgmental awareness, just recognizing, the science of the medication can be really helpful, because sadly, I don't think the medications in any way are, a complete intervention for ADHD. Most people benefit from a much broader approach, but at least that's covered for a family that's struggling with coverage, so it's like something concrete you can do. And I wish, it isn't fair that that's a decision you're forced to make based on coverage, but it's the reality sometimes. And then just in terms of resources for the non-medical stuff, it is certainly useful to know that there are a ton of really good people working online, so that if you can't find a coach or a behavioral therapist, that's affordable locally, there are a lot of supports online, and a lot of different price points, and a lot of ways to try to get that broader executive function support that way. There are a lot of great books out there, like, depending, like, whether you have ADHD yourself or whether you're a book learner or not, there's a lot of stuff you can, try to implement from that type of approach. Again, it's about understanding what's going on, but, and trying to see it as clearly as possible, and then, trying to make changes. So, there are ways to do it that way too. Even though in an ideal world, everyone would have equal access to, the behavioral interventions and coaching and such.
That was a good answer to a complicated question. So thank you for
Excellent.
that. I also want to ask, I always love asking this one. I ask you to dream a little bit, Dr. Bertin, like, if you could maybe foresee like the next 10 years of, you're like, man, if we could just do this in the way that we treat ADHD or the way that we approach or learn about ADHD, what would you hope in the next 10 or 15 years that things may change?
I think I've mostly answered that probably just across my answers today. I mean, to answer it, concisely, to kind of wrap up, I mean, I think as a society, people just don't understand how, ADHD, the rate of ADHD is about 1 in 15 everywhere. It's been studied.
Wow.
It's very common. It's very impactful. More and more, there's a little bit of a push. It hasn't happened yet to see it as a public health issue almost, because it impacts so many different things. And if people have access to comprehensive care, they generally do well. So I think if over 10 or 15 years, we can educate the medical field and the public to really understand ADHD as a, very impactful medical disorder of executive function, and, in a, non-judgmental way, just like this is what it is, and access to, the supports without judgment, not pushing away from any particular support or clinging on to any particular support, but just seeing like these are the possibilities, it would have a huge impact for so many people, both individually, really, and community-wide.
I have way more questions than we have time for. But Dr. Bertin, thank you for the gift of, I know you have some great books. We'll make sure that we link all those in the show notes, as well as some of the resources that you mentioned. But thank you for the gift of your time today. Thanks y'all so much for listening. That was a fantastic conversation. I hope that you'll do me a favor. If you love today's episode, please share it with a friend. You can also review over on Apple Podcast or Spotify or wherever it is that you listen to podcasts. You can also give us a listen and a watch over on YouTube. It's how we reach more NICU professionals. Today's podcast episode is sponsored by Reckitt Mead Johnson, whose mission is to nourish the world's children for the best start in life. For more than a century, they have led the way in developing safe, high-quality, innovative nutrition products and continue to push the boundaries of nutritional knowledge with consistent, strong investments in scientific exploration.